I would like to welcome Kevin McLaughlin to the Doc Podcast.
The patient comes back on the second visit and they can tell me, I'm about 25% better. They're going to be more engaged in their recovery, and you need an engaged patient. So everything I do now is based off of the McKenzie assessment, the mechanical assessment, and then treat based upon that. If people are telling me that, it only hurts when I do certain things, and if I let it rest within 15, 20 minutes, it goes away, that's more mechanical than it is inflammatory. Tell me about the behavior of your pain. What makes it better? What makes it worse? Is it intermittent? Is it constant? Because that tells us a lot about the type of problem we're dealing with. One of the best dental hygienists I ever had did her entire treatment of me standing. What I usually try to tell my dentists I've worked with and hygienists is, as best as you can, regularly interrupt that posture by moving into the opposite direction. It's the lack of recognition that you're doing this over and over and over again that leads to problems. If someone was to come to me with a complaint of, let's say, elbow pain, or a dental hygienist or a dentist, my first goal is to establish, is this a mechanical issue? Is it an elbow problem, or is it coming from their neck? If you're hunched over or rounded shoulder most of the day, your parascapular muscles are working so hard to take stress off your shoulders. They're going to fatigue and weaken. Some of the dentists that I've treated over the years, when they're later in their career, even retired, they have very kyphotic, rounded shouldered, forward head postures. Their spines almost like question marks. I don't think you can ever eliminate injuries in the type of work that you do, but you can mitigate the extent of them for sure. People don't quite know how they got in this position, but once we solve the problem, teach them what the fix is, they need to know how to continue to maintain that. You have to give them the tools to maintain it. My general advice to people is try to stretch what's tight and strengthen what's weak. Most patients experience neck pain, back pain, or other musculoskeletal problems that it severely inhibits their lifestyle. Once they find what helps them, they don't stop. And our whole goal is patient independence of the clinician providing the care. We're going to expose this tissue to some stress that you can tolerate. It's going to be painful, but if we continue to expose it to a low level enough that is stimulating your symptom but not aggravating your symptom, it will become desensitized, but it will take weeks. You have a patient that has something you're not quite sure, it could be musculoskeletal, they're frustrated by it, it's facial pain, it's not of an origin that you're typically experienced with, there's no harm in referring out to a PT that has experience treating mechanical problems. You just want to make sure whoever you're working with is attentive to what you're telling them and has an active interest in your recovery, and not just trying to fit you into a box of, this is how I'm going to treat you because this is how I treat everybody. It's what's in the best interest of the patient is what it comes down to.